Good afternoon, Carlos Marcus. Let's begin the warm-up session. What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It's always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult but also rewarding.
How do you deal with someone who isn't satisfied with your patient care?
When faced with a dissatisfied patient, I assess the issue, determine if it's something within my control to correct, address their concerns, answer their questions, and collaborate with colleagues for alternative solutions if necessary. My goal is to accommodate the patient without compromising their care.
Tell me what you feel is your greatest skill as a nurse.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you could do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want help, and when I can't, that's hard.
How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
Your preparation time is over. Please start your OET speaking roleplay. I can truly hear how distressing this has been for you, Mihira, and it's completely normal to feel that way. My name is Carlos, and my most important job right now is to ensure you feel completely ready and confident to go home. I'm here specifically to provide you with your detailed post-discharge instructions and to explain all aspects of your cast care. Does focusing on that plan sound helpful to you? Yes, please. I need to know what happens next. Of course. Let's start with a positive update. The procedure to set your arm was a success. The cast has been applied and will need to remain on for the full 4-week period to ensure the bone has adequate time to heal firmly and correctly. We have your pain managed effectively with the medication given here, and your overall condition is stable, which are all very good signs. Now, to ensure this progress continues at home, let's move on to the specific instructions for your cast and recovery. Thank you for the information about the treatment done. Is there any particular care I have to take?
Mihira, I know having a cast is a big adjustment, but taking good care of it is essential for a fast and proper recovery for your arm. The cast is now protecting the bone as it heals, and we need to keep the environment inside it just right. The most important thing is to keep the cast completely clean and dry. This means you'll need to cover it with 2 plastic bags, secured with tape or a rubber band, anytime you shower or bathe, and be very careful not to let any water splash onto it. If the cast gets damp, it can weaken and lose its protective shape, and moisture trapped inside can cause skin irritation or even infection. Also, please resist the temptation to put anything down inside the cast, like a coat hanger or a pencil, even if you feel an itch. That can damage the padding, scratch your skin, and again lead to an infection. If you have an itch, sometimes tapping lightly on the cast or using a cool compress on the surrounding skin can help. In terms of how you manage the arm itself, remember that the first few days are when swelling is most likely. To help prevent this and keep you comfortable, it's vital to elevate your hand and arm above the level of your heart as much as possible, especially when you are resting. You can do this by propping your arm up on pillows while you sit or lie down. Another important instruction is to avoid putting any weight or pressure on the casted arm. Do not use it to push yourself up from a chair or carry anything, as this could shift the fracture or damage the cast. Finally, even though your wrist is immobilized, it's very helpful for circulation and preventing stiffness if you gently move and wiggle your fingers frequently throughout the day. This simple exercise helps keep the blood flowing and the muscles toned. We will review all these instructions in detail at your follow-up appointment. Do you have any questions about keeping your cast in top condition?
That's very clear. I'll be very careful. What about the pain medicine?
Let's go through the pain management plan in detail. We are sending you home with acetaminophen. The specific dosage is 1,000 milligrams, which you can take every 6 hours as you feel the pain returning. It is crucial to understand the maximum daily limit of 4 grams or 4,000 milligrams in a 24-hour period. Exceeding this limit, even by a small amount, can cause acute and severe damage to your liver, which is a vital organ. As with any medication, there are potential side effects to be aware of. While most people tolerate it very well, some may experience gastrointestinal upset, like nausea, or in very rare cases, an allergic reaction such as a skin rash. Mihira, do you have any questions or concerns?
No, I understand. I'll be sure to space it out and not take more than 8 tablets in a day. I am worried I won't know if something is seriously wrong, though.
That is a very valid concern, so let's discuss potential complications with precision. You should return to the emergency department immediately if you experience any of the following: sudden severe pain that breaks through your medication, which could indicate a new injury or compartment syndrome; excessive swelling that makes the cast feel too tight and doesn't resolve with elevation; or if your fingers appear pale, blue, or feel cold, which are signs of compromised circulation. Additionally, a foul smell or any discharge from the cast suggests a possible infection inside, and a fever is your body's systemic sign of fighting an infection. A loss of sensation or a pins and needles feeling that doesn't go away could indicate nerve pressure. Mihira, I want to reassure you thoroughly that while we must discuss these possibilities, they are statistically rare, and the vast majority of patients have a smooth and uncomplicated recovery, especially when they follow all the instructions for elevation, movement, and medication as we've discussed.
Knowing the exact signs to watch for is a relief. I will certainly be looking at my rugs differently now. I have a long hallway from the front door to the kitchen with a runner rug, and another small rug by the sofa.
That leads us perfectly into our next crucial topic, home safety and fall prevention. Based on that, let's be specific. Mihira, removing tripping hazards means specifically taking up those loose rugs, as they are a primary cause of falls. You should also ensure electrical cords are tucked away and that clutter is cleared from floors. Improving lighting involves installing brighter bulbs, adding a night light in the hallway and bathroom for nighttime trips, and ensuring you turn on lights before walking into a dark room. Using non-slip mats is essential, but only ones with a strong grip backing, and they should be placed securely in the bathroom and kitchen. Furthermore, I advise you to move slowly, pausing for a moment after standing up to ensure you feel steady before you walk. Given your injury, your ability to perform daily tasks will be limited, and you will need assistance with daily tasks. What kind of support system do you have at home? Is there someone who can help you with activities like cooking, cleaning, or getting dressed?
My son lives close by. He has already said he will stay with me for the first few days to help out. He will handle the cooking and cleaning, and my neighbor said she can pop in too.
That is wonderful to hear, Mihira. A strong support network is so valuable. Finally, let's talk about your follow-up appointment, which is scheduled in 3 days. The importance of this appointment is multi-layered. The primary reason is for the doctor to take a new X-ray to check the fracture's alignment and ensure it is healing in the perfect position. They will also assess the cast integrity, looking for any cracks, soft spots, or areas that have become too loose, as a well-fitting cast is essential for protection. Based on this assessment, they can change the treatment plan if needed. For example, if the bone is shifted, they might need to recast it, or if the swelling has reduced significantly, they might replace this initial cast with a lighter, more comfortable one. This appointment is a critical checkpoint to ensure your recovery is on the very best track. Now, after our very detailed discussion, what final questions or concerns can I address for you before you leave Mihira?
No, Carlos. You have been incredibly thorough and have put my mind at ease. Thank you so much.
You are most welcome, Mihira. It has been a privilege to care for you. You have a solid plan and excellent support. Remember to be gentle with yourself, and we will see you in 3 days. Safe travels home.